I'm currently the interim director for the Centre for Domestic and Family Violence Research in Queensland, Annabelle, and we're very privileged to have you here in Australia, specifically here in lovely Mackay, Queensland, that we're very proud of. I think Jude will concur. Now I'm just going to let you introduce yourself, Annabelle, and Jude, for you, and then we're going to have a little bit of a discussion about just what we can learn about New Zealand, about your work and what's happening.
Oh, well, kia ora kōrua. I'm Annabelle from Te Awatea Violence Research Centre, which I'm the director of at present. My home is in discipline of social work and human services, which is a very eclectic discipline and borrows from a whole variety of sources of knowledge. I'm really pleased to be here with you, and I've been very much enjoying the Mackay weather. It's pretty amazing. Yeah.
Kia ora, Annabelle, and haramaki to Queensland. Lovely to have you here. I, like you, am New Zealand by birth. I have been here for 5.5 years. Currently, I'm the manager of the Domestic Violence Resource Service here in Mackay. We've always had a wonderful relationship with SIDFA, and we hope that will continue. I'm also the convener of the Queensland Domestic Violence Services Network. I was the convener until July the 1st. I'm now the secretary. So we have a statewide organisation that I'm deeply involved in. So welcome.
And Jude, you're also a pivotal member of the Ending Violence Against Women Queensland steering group that's forming the PEAK.
Yes, we've recently actually formed the PEAK, which is Ending Violence Against Women in Queensland, and we're working with the sexual assault services and the refuges and some of the women's health services to lobby and work together to make things better for women.
And that's quite an advance for Queensland, Annabelle, to have the women's services, recognised as a PEAK, and consequently to have, I guess, a voice. In New Zealand, in your work, is there a DV PEAK? Is there a women's services PEAK?
Not on a national. The national organisations meet, at a regular level, but a broader collaboration has formed in regional areas, and Canterbury's led the way in that respect post-earthquake, because it's ironically, but in some ways very positively, opened up the opportunity for organisations in the family violence area to recognise the need to work together in the rebuild of Christchurch. They all lost their offices, so this opened up an opportunity to think about how they might work together in the future, and it's opened up conversations around co-location of services and much greater sharing of resources. So I think Canterbury in that respect has led the way, but I wouldn't say that that's necessarily reflective of the national situation. So it's great that Queensland as a state has this collaboration forming. I wondered in regard to that whether care and protection services are involved with that. Or is it?
That's a slightly different part of our work, which of course combines with it. But we're working at the moment on the outcomes from the Carmody report, which was a report commissioned by the government, the state government, that Heather has been deeply involved in, that has resulted in conversations around dual referrals and working far better with child protection services, child safety as we call it here.
We having Kathy Humphries, visiting scholar from University of Melbourne, up next week to talk about the nexus between child protection and DV, which is an area of research, of course, in your area too. And she cautions, and I guess this is what we've been advocating to government, not to just everyone understands the importance and the statistics relating to DV, but in child protection reform, history shows us it can be quite a fraught relationship, and indeed, I think if I use Kathy's terminology, be careful not to just graft domestic and family violence on, to the side. It's got to be part of the framework. Do you have any comment and practice in relation to that child protection DV space?
Look, I think there's a long way to go in the conversation between the two sectors. They've both got quite different histories. There's some commonalities, but there's some quite distinct histories. And that history has led to quite different systems and structures now for both sectors, and also different sort of justice approaches. I mean, I've come to ponder on that and wonder whether it's timely now to start thinking about whether those separate justice perspectives are necessary, and whether there are some ways in which the approaches in both sectors might benefit. I'm actually thinking here particularly of the fact that in Aotearoa we took a restorative justice approach with our family decision making in care and protection, which we've held on to. And I wonder, and my research lately has been exploring this in terms of the, what it may have to contribute in the domestic violence area. Now, I'm very aware in talking with practitioners that this is a fraught area in that in no way do any of us want to jeopardise safety. And safety has to be, primary in our thinking. But nevertheless, I think there's definitely room, to consider other ways of addressing domestic violence conflict than in the ways that we perhaps traditionally have thought of. So, particularly in line with Indigenous thinking. I think
yes. One of the things that I believe is different is that protection orders here are given in a civil case from the domestic violence court, which is just a subset of court and meets usually every day in different areas, and a magistrate decides about protection orders and temporary protection orders. And the family law court is a completely different court. It's a federal court, not a state court. So that seems to me quite different from Aotearoa's experience.
Yes, and those layers of state versus federal law make it more complex, potentially, in terms of reform and thinking about, ways to do things better.
Sure. The family group conferences have always been, very interesting to me. I've known people who've been facilitators on them, and I know that you've done some research or been involved with them there. How do you see that continuing or relating to us?
Well, we just completed a preliminary evaluation of family group conferencing in New Zealand, where we interviewed people at different sites up and down the country. The results are very affirming in terms of the process, primarily, but there are ongoing concerns in regard to some practice in some areas, and there is always that ongoing issue around workforce development and the skills that staff bring to the conferences. One of the key issues around there is the need to be culturally responsive, and the ability of different child protection officers to demonstrate that skill and ability in practice. It's one thing to have it in the policy of a department, which often looks pretty good, but it's when you get down to the experience of families that you really discover how things are working.
And I think that's an area also when Jude mentioned the Carmody, what we're calling the Carmody report, so that came from the Queensland Child Protection Commission of Inquiry that finished in 2012, was it? The report 2013, forgive me if that's...
it finished in 12, the recommendations came through.
Very much the recommendations have been accepted by government, and around family group conferencing or how family meetings should look, certainly some learnings from that New Zealand model, and while Queensland does have family meetings, they would, it may be the power differential and some of the components sometimes, as we know, that unless there's skills and there's a clear framework and endorsement by management to in the way they should be conducted and for the purpose they should be conducted, it can turn into what is essentially a child protection meeting.
Yes.
So it is an interesting space, I think, there too. So in Queensland, Annabelle, this reform that we're calling child and family reforms is moving very quickly. There is significant funding as part of those reforms, but most importantly there is an intent, even in these difficult times, to co-design, about co-design and co-production, so that there is an involvement, by all key stakeholders. I guess anywhere in a political climate, it's difficult to, sometimes with pressures on how fast money they need to get out into the field to maintain, possibly the essence of what the intent was. So I think it's an area we're all very thrilled in Queensland that we feel we're moving forward in both the child protection and domestic and family violence sector, would you say, Jude?
Yes.
But it's also understandably fraught with, parameters of time frames, and particularly in Queensland as a very spread out communities, a large component of regional remote, very diverse communities, so again it comes with complexities. For any, you've been part of inquiries in New Zealand, if I just refer to the child protection inquiries, are there any cautions from you about rollouts, particularly in that child protection DV nexus, and what might you see as opportunities though? So as there's a chance to co-design, if I use that terminology, what would be the things you would think might be important we should be thinking about in this space from your experience and research?
That's a really big question, and it goes to the heart of what we're doing at the moment. I think I might just take that back a bit, the conversation, because I think theoretically and in turn sort of informing policy, we need to think through what we're meaning by what we're doing. And so if we're going to call it family violence, which encompasses both child abuse and neglect and domestic violence, then that creates a different, potentially a different structure and a way of strategically planning an integration of services that for both fields. That's certainly what we're coming to in the major piece of work that I'm involved with nationally at the moment. We're thinking that the colleagues that I'm working with who come from a different discipline, they come from systems thinking, which is interesting, are arguing that in order to address these two issues more effectively, we have to think in terms of systems and what and they experts in viable systems. And in viable systems theory, these two phenomena would be argued as wicked problems. I haven't actually used that term before, and when they used it, I said, it was. And again, it's that interdisciplinary conversation that we have, but it is wicked, and entrenched. And what we're coming to though is that we need to think through the national policy and thinking around these areas so that it appears integrated. I mean, at the moment we have a separate care and protection conversation and a separate DV conversation, and it's about how those two can intersect. I mean, what we're coming to realise and acknowledge and recognise in Aotearoa is that family violence needs to include domestic IPV, intimate partner violence. And similarly, child abuse and neglect is almost inevitably symptomatic of relationship issues within the family. So there really is a need to sort out this thinking at a very high level in order to be much more strategic about how to look at these two areas in an integrated way. I mean, I've long been concerned about the risks of just attempting that integration at practice level without doing that thinking through. The risk there, as I see it, is that if the police, for example, come to intervene in an instance of IPV, and then automatically assume that the children need removing, as an example, we've got to be really careful about thinking through the implications of that in terms of practice. So that's why I think we need to be so careful about thinking and planning at a much higher level in order to get this structured in an integrated way, so that there is a framework within which people can operate safely and not disadvantage or discriminate, against any of the parties who are involved in the situation.
Yes.
I think it's valuable insights, and we've sort of all been working very much in that space for that reason. But it's interesting to hear you encapsulate it so well. Of course, in Queensland, as across Australia, there is a great deal of overrepresentation of Aboriginal and Torres Strait Islander populations. Sadly, in the child protection stats and of course the family violence stats, that there is again significant work, and I think the necessity of responding appropriately from both a cultural sense and practice sense is always a fraught problem in itself, given communities are not homogenous, and in your work with the Maori population, and of course I'm by no means aligning the Maori population with Aboriginal and Torres Strait, but it would be interesting around considerations in, I suppose, factoring in cultural sensitivity and appropriateness in health engagement, to hear some of your insights, or again things we might need to think about.
Well, one of the findings in our Family Week Conference evaluation has been that there are some sites with excellent practice and with remarkable results and outcomes. And so I think that we've tended to focus, I think I mentioned this earlier, on deficits. We tend to focus on where things are going wrong. There's good reason for that, in the sector, because there are high stakes on things going wrong. But nevertheless, things do go right. And so this is an example where in a strong Māori community in the North Island of New Zealand, one of the officers there is demonstrating, extraordinary practice. Now, I'm hesitant to pinpoint exactly what that might be brought about by, because this is a preliminary study, and really what needs to happen is a substantive evaluation, much more substantial than what we've done. But at this very preliminary stage, it would seem that what makes the difference is having a manager in their office who speaks Māori, who is skilled in Māori tikanga, who knows the local marae, who has relationships with them. He buses his staff out to visit those communities so that they get to know who the elders are. And in that way, they're much more aware and knowledgeable about the resources that are available to them in coming to solutions in conferences. So I think that's one of the key findings that we have around cultural expertise, that it really is contingent on having skilled and knowledgeable staff. Now that staff member is Pākehā. I think it's actually German. But here we have someone who's really made the effort, and is, as I say, producing quite extraordinary results. So I think it would also be it's always important in my view to acknowledge the Indigenous history in respective countries. I mean, within Aotearoa, we have years of colonisation that Māori have experienced, and alienation, and for all those reasons they are represented also in the lowest SES data in New Zealand. And I don't think that's what's the word? I think that's that may well relate to the years of discrimination, disadvantage. Now, what's really interesting in relation to that is that New Zealand has a couple of world famous longitudinal studies, one based in Dunedin and one in Canterbury. The one in Dunedin did a study looking at comparing the outcomes for Māori children within the data set. And interesting, what they found was that where they had Māori families with comparative SES to Pākehā, so reasonably high levels of SES, the outcomes were very similar for children, with Pākehā families. And, what does that tell us? What does that tell me? What it says to me is, that we've got a major socioeconomic and social gap, that really does, so it needs addressing on all fronts. And the care and protection system and the domestic violence system is not going to be able to do that, on its own. It needs a whole of government, response, in order to lift that.
Yes.
Annabelle, I was interested in you talking about that what appears to be a good practice model, but busing staff out to meet with the community. And I've heard you speak previously the importance of relationship. And do you think in that example, so the forming of relationships, and as you were pointing out, this was a Pākehā, going into a Maori community in Maori Marae. How important is relationship and all these aspects we're talking about?
Well, I think it's essential, but it's also about an approach to relationship which accepts that the experience and the expertise lies in the community. So so outreach is necessary to creating that relationship between structures, between systems and people. It needs that outreach and ability to communicate with people where they are and how they are and with what they're experiencing. It's one of the tendencies, sadly, in setting up a professional system is that, for workers to end up fixed to their computers and spending a lot of time on administration and systems, risk management, and not see beyond that to the importance of this. Now, one of the things that's just happened in the care and protection system in New Zealand is that Child, Youth and Family conducted an internal review, which was excellent, that they took this step. An internal review of their staff workload and sort of analysing the proportion of time that they were spending on different duties. As a part of that internal review, they discovered that New Zealand social workers were working much more than many other jurisdictions in the world, that their caseloads were almost twice in some instances. And so what it has done is it's caused the department to pause and reflect on what it's actually expecting its workers to do. So, while they're we might again come back to that policy, the sort of high-sounding principles around, what we're trying to achieve with protecting children, it's also really important to make sure that the people who are commissioned with that job have the resources and the time in order to be able to do it properly. So that's another, and I think across the sectors, so that applies to DV as well. Ensuring that police, for example, are adequately resourced in the area of intervening with family violence. Ensuring the health sector is, it is really a multi-pronged issue of making sure the resources are there.
Over here, Annabelle, we've talked recently and worked towards more collaborative practice with a really wide range of community and statutory organisations. I wonder if there's a comparison in Aotearoa that you can talk about.
is this at statewide or
No, this
or
is
locally?
at local level.
Yes.
Yeah, we here have a coordinated community response that we
Yes, yes,
actively
great.
pursue.
Yes. Well, I used the example of Canterbury,
Yeah.
which, to my knowledge, has one of the most developed collaborative approaches in New Zealand. And as I mentioned earlier, this has emerged. It was actually forming, and our Violence Research Centre was part of the initial discussions with originally women's refuge organisations around forming collaboration just within their sector prior to the earthquake. Post earthquake, it's opened the opportunity to have this much wider collaboration, and so now it involves the statutory sector. That collaboration is now funded by our Ministry of Social Development to a degree, so there are, there's resource capacity to service a large group. It's now at the point where they're sharing training opportunities across the sector. The group involves sexual assault services, child protection, domestic violence. Those are the key players in there. But it's really great to see the way in which they're operating, in that way. There's a lot of potential for that to continue to expand. But that's great. It's wonderful that it's operating, already.
Absolutely.
You are right, though, Annabelle. I think the tension always is the resourcing and often the pressure to, and I think the terminology is, there needs to be the frontline service delivery, meaning the direct service delivery, but around that, if you don't have the networks, the partnerships, the relationships for a response that is holistic, it doesn't happen in the way it's meant to. And I think the acknowledgement of the importance of coordinated community responses and other networks is one that is again has some tension. Do you find that, Jude, in your practice?
It's very important, and it's not an easy task because we come from so many different philosophies, and sometimes finding that point where we can work easily together and put aside some of our beliefs so that we can work with each other. It's always it's always a slightly tense process, but we've worked a lot, and I think we've changed the attitudes of a lot of people in the community that realise that we need you need us. We might not agree on this, but we will work together for the safety and for the best outcomes for the people we work for. That's the big thing.
Yeah.
We all recognise that.
Yes. Yes, it's a sector which is characterised by this, again, I think it comes back to relationship. And unfortunately, a feature of it is often conflict, and as you say, it often arises from different perspectives. But there's a couple of things I want to say about that. I wonder about the work itself, that, in that it's very difficult, it's potentially very stressful, and, whether that means that leaders in particular groups, community groups, have a passion about the work that they're doing, and sometimes that may get in the way of being able to, cross that passion to sort of walk in someone else's shoes. I think one of the things that arose from the earthquake, and I don't want to come back to that too often, but was the agreement by those of us who got together immediately post-earthquake to take a helicopter view. And I think if people can be encouraged to take a helicopter view, which removes their personal investment, and it may be too much to ask, but one of the things that we're grappling with in Aotearoa is the fact that in both care protection and family support, and in the range of the suite of stopping violence services that's available, there's a plethora of organisations that have formed over the years. With the increased focus on evidence-based practice and the contracting environment that governments are inclined to follow at the moment. And it's understandable that governments are concerned about outcomes. I mean, I think we should all be concerned about those.
Absolutely.
But with that focus on outcomes, there are very few of the organisations in the sector that have had the resources or the capacity to be able to evaluate.
Yes.
And so we're left with a situation where there is actually a significant amount of investment in the sector, but we don't really know which areas are most effectively invested in. And I think that's a real challenge. You know, it's a challenge for the agencies themselves. I mean, I come from community organisation participation. That's my roots, if you like. And so, but as a part of that membership, the boards that I've been a member of and that I've chaired have always had the view that we're not here just to for the sake of it. You know, we're not all giving up one night a week, you know, per month or per month or whatever, just to be in the business of looking like we're doing something, you know. So the agencies I've been engaged with have embarked on evaluation strategies and successfully sought evaluation funds. So I think the sector really needs to be committed to, you know, to this. It's definitely a requirement of governments now, and I understand that, particularly given your, you know, earlier comments, Heather, in regard to the tensions that the governments have in balancing their, you know, the different demands on the economy.
It is. I would agree with you, Annabelle. Re-evaluation. You know, it's in this space too. Some of the reforms have built on intensive family support responses that have over several years. And the last response was an initiative called Helping Out Families, which was predominant in the southeast corner. And recognising that there needed to be a response to DV was included. Health home visiting was included. So by any counts that was a positive, and there was a large amount of funding that went to that, and there was an evaluation. 4 years later, that has provided both findings and evidence that have influenced this reform. Unfortunately though, this is where evaluations, you know, are so important, but in actual fact, in the scope of the evaluation, domestic and family violence was excluded, as was the health home visiting. So it was very much looking at that, how they focused on an alliance of services. They were looking at how that worked, and that was very important. And the child protection family support nexus. Now, it's not that there's not good findings about domestic and family violence, and there's partners of Jude's and they've been part of this. However, I would agree with you. I think a caution is it is so important to have rigorous evaluations that are also inclusive, both process and impact. And I think, again, with pressures and sometimes the rigour of the evaluation or even the scope may not be as conducive to, or the findings may need to be taken into that perspective. But Annabelle, in New Zealand, for some of the initiatives, you were saying there'd been a review of the family group conferencing, or was that an evaluation? How important in the Queensland reforms that are just starting to roll will evaluations be, do you think, and when should they be built in?
Well, look, and certainly the recommendations that we're making in the report that I'm involved with is going to be recommending evaluation to be built in right at the outset and resourced adequately. But you're right, it's not simply a question of evaluation for evaluation's sake. It's got to be appropriate for the purpose. But look, I just want to take that discussion about evidence just to another level. One of my community organisation backgrounds and experience was in a home visitation service, which policy-wise fits within what's broadly regarded as general family support.
Yes.
Yeah. And I did a piece of work there looking at intimate partner violence in the cohort that we had at the time, and found a high incidence within the population. But interestingly, it wasn't a focus of our service. So it wasn't actually a target of the social work practice necessarily.
Mm.
It was one of the things that was measured at intake, but it wasn't necessarily one of those areas that, I mean, if it impacted on the safety of the children, then clearly the workers would. And in terms of overall well-being of the family, it would be one of those things that was focused on. My concern coming out of that was that this home visitation service, in sitting within this broad family services sector, indicated to me that our workers had probably insufficient training and experience in this area of detecting and understanding intimate partner violence. And our results showed how pervading it was, within the cohort, high risk cohort that we were working with. Now, I just want to take that to another issue which relates to it. One of the other things that we have found in our scoping of New Zealand in regard to understanding incidence and prevalence is that there are real gaps in the data collection and the ways in which data is collected in both sectors in regard to care protection and domestic violence. And it's a real problem because all of the international literature that I'm scoping at the moment indicates a much higher level of an incidence of violence towards women and children than comes through in the official data. So, we know that the self-report methods always find an enormous amount more incidence and prevalence than the official data. So we can take it from there that both problems are much more extensive than we actually have a handle of. We've got a bit of a picture of it through our official sources. Now, there are some very good examples of consistent data collection in other countries, and the Netherlands is one that I've come across where what they've been doing is taking 3 sets of data. They're doing sentinel data, which is where they interview care and protection social workers about their caseloads. And they interview 1,000 or so, so it's quite really extensive there. They use the notification data as well, that comes in. And as we know, notification data only tells you so much. It's not going to tell you which one to justify. And then the third piece of data which they triangulate this with is that they interview a large sample of secondary school students retrospectively to talk about their experience of child abuse and family violence.
Oh, yes.
So then they've got these 3 data sets which they're doing in an ongoing way, and which triangulate against each other, and so they're getting a much better picture of what's really happening. My concern is that certainly in New Zealand, the data collected by police is not necessarily matching or relates particularly well to the victimisation surveys. We've got crime and safety surveys now, which have their own particular methodologies, and I'm not satisfied that any one of those is really capturing what, in fact I'm sure it's not, capturing what is happening. So I think certainly for New Zealand, we're recognising that it's really critical and urgent that the data collection systems are developed, that there's a consistent method, that it's triangulated, with qualitatively and also retrospectively, so that we get a much better picture of what what's happening. my reason for saying that is that, you know, in order to, when we come, I'm linking this with evaluation, in introducing reform, the problem is, you know, how does a government estimate the impact of reforms in which they have significantly invested,
Yes.
without being able to detect trends in some national data or you know, or statewide data? You know, because it's those trends that are going to tell you whether those policies are having, you know, the kind of impact that they have. Sadly, what tends to happen is that there are pockets of evaluation consequent on reform, but they're not going to give you that, you know, that big picture about, you know, what's happening across, you know, across all communities. So I think, you know, in order to us, you know, for us to grapple with this, it's going to take you know, a really big investment in how to collect data.
Yes.
Get a better.
So, in Aotearoa, the investment from government is relatively substantial. What's the interlocution between you, the researchers, the practice, and government?
Well, I mean, you know, if you're going to do an economic measure, you'd probably argue that it is substantial, but it's happening in different sectors. So the health sector's collecting data within the hospital system, the health system. It's not correlated or shared necessarily with child, youth and family. The police are collecting their data in their way, and it's not necessarily correlating. You see what I mean? So, you know, you could say, if you took you know, again, that helicopter view, if you took that, you'd probably decide that there was a significant investment. What we're saying is that this is giving us patchwork. So it's we're calling it a patchwork. So you get a patchwork understanding, and it's not sufficient to be able to understand the you know, the impacts of policies and interventions. It's and what it tends to lead to is that you have a patchwork of interventions developed in health because they recognise they've got to respond to family violence more effectively. Doesn't necessarily relate to their local women's refuge. You know, and so this is the other. The recommendation that we're coming to around this national strategy, which is the need to, what we're suggesting is to invest in a national authority that has the power to pull this data collection together, or to create one which is going to link, you know, adequately across the sectors.
Thank you, Annabelle. It's you started off by saying you're referring to the wicked problem, and that's a terminology that in a RACI report came out, I think it was 2009, and that was the first time I'd seen that that word, and it was referring to the child protection system, and it was saying, you know, they defined a wicked problem as one that you know, one organisation, one part can't resolve. It takes multiple players. There's multiple facets to it. So that word sort of hung in with me too. And I think the other one was someone saying, and I know it's I'm not sure where the saying came from, but you know, for every complex problem there's a simple answer, and it's always wrong. In other words, it's not easy. I think our discussion is, it's not easy, it's worthwhile, but it needs the consideration, the debate, the time to listen, the time to form relationships and to move on. So thank you, Annabelle. I'm conscious too that in this discussion, I'm thinking with time and our people, we've only just touched on some very interesting concepts, and I was, the original intention was really fascinated by your book, Understanding Violence, Context and Practice in the Human Services, edited by yourself, Annabelle Taylor, and Marie Conley, University of Melbourne. Yes. We'll just touch on this book in ending because people may like to refer to it. And Annabelle, I might put on record almost, we'd very much like to talk to you, possibly through webinar, other means, in a research seminar in the near future. Could you just touch lightly on the book, because it was published last year, was it 2013?
Right.
Yes, and what brought it about?
Well, it has its roots within Te Awatea Violence Research Centre. We were committed to disseminating research and information so that the sector had access to it, so students and policymakers had access to it. We see that as vital as being part of active researchers. So it represents a story of researchers who've come together.
Yes.
It represents links and relationships that have been made, both nationally and internationally. I think the international relationships will go on to develop further, and I look forward to that. And yeah, I think we're very proud of the book as it is, but we're also aware that we want to do continue to develop this. With another edition. It's a very dynamic sector. Things change. All the time, don't they?
Yes. So
It's everyone's story. So it looks absolutely fascinating. So it covers everything, doesn't it? From culture and violence, notions of restorative justice and violence, the media, so risk and social networking, self-writing again about women and violence, intimate partner violence, working at the front line in domestic violence, violence towards women. I'm just doing a bit of a catch. Animal-human relationships and human-animal abuse. It's very topical. And obviously you and Marie do your concluding thought. So just ending this, I'll just maybe repeat that for those listening. The book is Understanding Violence, Context and Practice in Human Services, Canterbury Publishing.
Canterbury University
Publishing Press, and edited by Annabelle Taylor and Marie Connolly. Some people may like to indeed refer to it or look it up, and I would like to invite you possibly to talk more in relation to this in a future session. Is one of the things SIDFA is a critical area is in sector development with the research centre, making available practice, research, in a way 24/7, so on our website, and really wanting services, not just DV services, but those working or encountering domestic and family violence. I suppose to have those little snippets or seminars or thoughts that I think provide for all of us the criticality of what we're doing and also information, support, ideas. So Annabelle, thank you so much for your time while you're here. Jude,
thank you, Annabelle. It's
No,
lovely to hear the practice again, from Aotearoa.
Thank you.